Welcome to The Buzz, where we bring you the leaders in dental education, discussing hot topic courses and industry trends. I'm your host, Vanessa Emerson, founder of Dental Speakers Bureau, and today I'm interviewing Dr. Warren Jesek. Thanks for being here, Warren.
You are quite welcome.
Now, Dr. Jesek has achieved a master's in the Academy of General Dentistry, and he's also the 2018-2019 president of the American Equilibration Society, also known as AES, and they are leaders in occlusion, TMD, and comprehensive oral care. I've invited Dr. Jesek today to speak about his course, Definitive Diagnosis and Treatment of TMD. I know that this is a passion for you, an area that you really enjoy, and I also believe that this is one of your most requested topics.
It is.
Could you share with us why you think that is?
Well, there's so much confusion in the area of treating headaches and occlusomuscle pain that someone has to ring the bell or scream from the top of the mountaintops. I've been doing it for a long time. There is a distinct relationship between occlusion and muscle headaches that are generated from that way. And I think TMD is one of the most underdiagnosed and undertreated and controversial treatment areas in dentistry. And it is basically, good occlusion is the foundation of restorative dentistry that lasts for a long period of time. I too suffered from a problem. I ate my teeth by the age of 40. So I had to have my mouth restored. And I'll tell you what, we've become experts in what affects us the most. And this truly is an area where I can answer a lot of questions because so many dentists say, I don't know anything about TMD and I don't want to learn anything. And I really have the ability, I'm sure, to encourage people that they can help so many people with some simple things that I teach that you can take home the same day you're there. You can go home, you can change something. You all have an aunt, a wife, a child, a friend, a neighbor that is suffering from headaches and have had multiple treatments that didn't work. And listen up, and I'll send you home with some things that you'll start treating people, and you want to create some raving fans that will say to you, what am I going to do when you retire? Who knows how to take care of this? You got me out of pain 25 years ago, and you've kept me out of pain. How? What? So my passion is to unleash more dentists, more general dentists, and the understanding that they are on the wall for so many patients that they can help them relieve them of headaches and aching teeth and sensitive teeth. And this course really opens your eyes to some good literature. I'm well founded in the literature. I have friends that publish in the literature in the United States and Europe that are well founded, and we have arguments all the time on our treatment. And I'll give all that out. I've got a literature list that's really long that supports the dentist's role in treating occlusal muscle pain and also being able to differentiate. And the first part starts in differentiation. Is it a vascular migraine or is it an occlusally generated pain from the muscles? And so that's what we can really help with.
Well, I agree that it does sound like a very important topic and one in which you've got a much experience. Could you help our event planner who's listening in understand more specifically what's covered in the course? What are your teaching points?
Well, of course, we're going to talk about, medical history and then the occlusal diagnosis, but you can't see what you don't know about. And so we'll really talk about the diagnosis of occlusal muscle pain and then the treatment of that, including splint therapy and splint therapy that works for people. And then what do you do that's beyond therapy, the treatments you do, whether it's some minor changes to the occlusion, whether it's some orthodontics, or whether it's adjusting the teeth or some just any other general dentistry you might do and how it affects things. So what really really core in this is it's really a complete overview of how you can treat these patients that are having pain and occlusal issues like broken teeth, sensitive teeth, and joints clicking and popping.
Fabulous. And who is your typical attendee?
Well, for these, I usually get dentists that really want to have some direction, kind of like this course in particular will give them kind of a pathway for the neophyte dentist who's really looking for answers but doesn't know where to look. I will give them a pathway and people to listen to and some knowledge and the literature and so forth, et cetera, and give them the confidence that, yes, they can do something about it. And for the more experienced dentist that's had some failures and thinks none of this ever works, I can kind of help them say, you know what, we all fail, and I can help. If you try this, it'll probably work better, and please be encouraged, because I like the word encouragement, because encourage means to remove fear from people. And what I want to do is help dentists not be fearful of the temporomandibular joint and the muscles and the occlusion, because we all hated occlusion in school. So did I.
That's great. Is this varying lengths, full day, half day? Do you have a?
It's any length. I have the one, if I do a pure lecture, we can do it for the day, or a 4-hour format, or even crunch it down to the 2-hour or 90-minute one on splint therapy and so forth, etc. And I also do a 2-day in my office where I limit it to just 4 to 6 dentists to come in. Oh. And they become the patient within my office, and it's very intense. It's 14 hours of going at it. So we do hands-on, but primarily this one's a lecture, and it kind of rocks.
Oh, I bet it does. Well, is there anything else that would be important for the meeting planner to know before we wrap up today?
Yeah. There are people that come to this, when I do this, they'll go, wow, that was a good one.
Excellent. Excellent. I'm not surprised. Well, thank you so much for being here, Dr. Jesek, and for sharing with us around your course, which is entitled Definitive Diagnosis and Treatment of TMD. And for information on this course and others, please feel free to visit dentalspeakersbureau.com, where you'll find Dr. Warren Jesek listed with our within our bureau, and his contact information is available to you there, or you can reach out to me, info@dentalspeakersbureau.com, and we can put you in contact with Dr. Jesek. And until next time, be well, and thanks again for listening in.